Okay, so implants. Implants are a bit tricky, so we need to do an X-ray and a physical consultation to be able to determine your eligibility for implants. So the process goes as follows. First, you need to send us your X-ray and some pictures, and depending on how many empty spaces you have, we will recommend for you implants, and also we can recommend an economic option or the standard option, where because we can connect, for example, uh, you have an empty space here, for example, depending, this is not for everyone. In certain cases, if there's an empty space here, you do not need an implant here. We can just do a bridge, 3 sets of crowns connected together, and that will cover the empty space. um, it varies from place to place, from person to person, so we need to be able to determine that. But generally, implants are suitable for almost everyone. um, you need to have very good bone structure, and we can tell that only from the x-ray, and the quality of the teeth that's around. If you have a sinus issue area here, that we need to do sinus lifting. So sometimes patients with that issue, we need to do a sinus lifting operation with the implants, and 6 months later they can do their crowns. But normally, for normal patients who do not have any issues with sinus lifting, we can do safely the implants the first setting, and 3 months later we can do the crowns. So this is the standard times. Generally for our implants, we do have one implant. It's called Megagen AnyRidge, that not everyone is suitable for it. We need to check the person's x-ray very well to make sure he has very good bones. For this patient, and it has lots of conditions as well, for this patient we can do the implant and put the crown on top in the same setting. Normally there has to be some qualifications for that. It cannot be more than one implant at the same place, just one. And the implant, the bone has to be really good and has to be signed off by the general surgeon to be able to qualify for that. The reason why is normally why it takes 3 months, because the implant, I don't have an implant, but I have here a picture. So the implant, when it's screwed into the bone, it takes about 3 months for it to solidify around with the bones and really take a good grip around the implant to be able to withstand the strength and pressure of the crown and the teeth on top of it. So this is mainly why. With the Megagen AnyRidge, this is for the Megagen anyways. With the Megagen AnyRidge, it has a certain shape and characteristics and technology to it that allows it to bond faster to the bones. So yeah, but generally for most of the implants, a safe period is 3 months to give it for the bone to fuse with it and be ready for crowns. One note for that, you cannot host veneers on implants. You can only have crowns, so either porcelain or zirconium crowns. And yes, after your implant operation, you will get this guarantee. We will put for you the barcode on it, your name and everything. This is not from us, this is from the brand itself. And I have here a few from the different brands that we have. This is Bego, Medentica, Strowman, and Neodent. So yeah, they're all pretty standard. Each implant has a unique barcode to it, and we will give it to you. I don't have anyone with the codes with me. These are all empty, but yeah, you keep this with you, and we will this is just like an identifier for the implant itself, and the type used and the model. You also get the abutment, which is the piece that goes on top of the implant, which will host the crowns, because as you know, the implant goes directly inside the teeth so you cannot see it. But when you come for the second visit 3 months later, we open the area here, and then we put the abutment on top of it, screw it, and then on this place we can put the crowns. Let me see, just like this one here. So this piece, see, this is the implant. It goes fully inside the bones, and this piece is the abutment that goes on top of it, and then you can host the crown on top, just like this one as well. You will put the crowns on top of it, and this one will be connected here inside the implant. So know that, and if you do any implant, no matter where you do it, you paid for it, and you paid for the abutment that comes with it. All right, so don't forget this. This determines what type of implant you got and its credibility. So yeah, know your implant and be safe. So one more thing I'd like to add, lots of different implant types, and you may be tempted to choose different ones based on price. So this is Korean, German, and the Straumann is the Swiss. So Medentika, Bego, and Neodent are German. Megagan is Korean, and Straumann is Swiss. So this is the most expensive one, Straumann. In terms of quality, these ones are the best. That comes from our doctors, all right? But there are lots and thousands of others that are much cheaper, but horrible quality. But this is the ones we chose, and these are all great, and we attest to them. And these are the ones that we recommend for you, and you can do your own research.